Now, blood supply of the brain, arterial supply of the brain is derived from two pairs of vessels, internal carotid artery and vertebral arteries. Internal carotid and vertebral arteries, they supply the brain. Now, this is the posterior choroidal branch, this is the superior circular branch, pontine branch, labyrinthine branch, anterior, inferior choroidal branch, cerebellar branch, and posterior cerebellar and the posterior spinal artery, anterior spinal. Now see, internal carotid artery gives the following branches: middle, anterior and cerebral arteries. The internal carotid artery gives the following branches: middle and anterior cerebral arteries, anterior choroidal artery, posterior communicating. Now, if you have a short note, there will be a short note, the artery supply of the brain, and also when you are holding the specimen in these shock parts, then you will be asked to discuss the in viva, this arterial supply of the brain. So the major components, main supply, the branches from where it is coming, the vertebral arteries and the your middle cerebral arteries. Internal carotid artery gives the branch the middle anterior cerebral arteries, anterior choroidal artery and posterior communicating arteries. Now, Circle of Willis, you can see the posterolateral group of central arteries and posteromedial group, the central arteries. Now, this is the basilar artery. This is the basilar artery, posterior cerebral, posterior choroidal. Now, this anteriorly it goes crossing the optic chiasma and posterior communicating, and goes the anteromedial group of central arteries. The recurrent branch, anterior cerebral artery, this is the optic chiasma in yellow. Now, the middle cerebral artery, anterolateral group of central arteries, anterior perforated substance, optic tract, this is optic tract. Now, anterior, middle and posterior cerebral arteries give rise to two sets of branches, cortical and central. Anterior, middle and posterior cerebral arteries give rise to two sets of branches, cortical and central. Now, central branches consist of 6 main groups. They are anteromedial and posteromedial, right and left anterolateral, right and left posterolateral. This diagram is very important. The Circle of Willis and also the origin of the carotid artery and the vertebral artery. Cerebral cortex. Cerebral cortex is supplied by cortical branches. By cortical branches, anterior cerebral artery, middle cerebral artery, posterior cerebral artery. The cerebral cortex is supplied by cortical branches of the anterior cerebral artery, middle cerebral artery, posterior cerebral artery. It can be a short note of 4 marks. Okay. Now, the cerebral cortex is supplied by the cortical branches, I repeat, the anterior cerebral artery, the middle cerebral artery, posterior cerebral artery. Now, you practice these diagrams. You just have to draw the brain like this, and the middle cerebral artery, anterior cerebral artery supplies the posterior cerebral artery. Now, you can see the corpus callosum, the posterior cerebral, the sagittal section. of the brain. And the middle cerebral artery, the posterior cerebral artery. Now you can see the anterior cerebral artery supplying this portion, the middle cerebral artery supplying this portion, posterior cerebral cortex, this cerebral arteries. This is optic chiasma. Arteries supplying the internal capsule. The arteries supplying the internal capsule. See, this is an important figure, and you are supplying the internal capsule, because see, all of a sudden there is a stroke, cerebral stroke, then this portion is affected. And see, now you just draw this type of this figure. Now you can see the anterior limb, the genu, posterior limb, retrolentiform part, anterior choroidal part, and by branches from the internal carotid artery, this posterior communicating arteries, this portion, by recurrent branch of the anterior cerebral artery, this is portion supplied, by straight branches of the middle cerebral artery, this is supplied, anterior limb, genu, posterior limb, retrolentiform part, anterior choroidal artery. You just draw a label. Today, whoever is teaching you, you do finish today. And when the exams come, you revise. Don't leave it for later on. It is tough. It is this thing. Now, when you go to the lab, you see the brain itself. And please study, group study, and stick to one book. Now, artery supplying the thalamus. See, this is the thalamus. Now, this is the middle cerebral artery, the anterior cerebral artery, posterior cerebral artery, posterior communicating, and thalamo-perforating branches. These are the thalamo-perforating branches. This is thalamus, thalamo-geniculate branches, thalamo-geniculate branches, anterior caudal artery, straight branches of the middle cerebral artery, anterior cerebral artery. Arteries supplying the corpus, striatum. Striatum, now you can see the chordate nucleus, lentiform nucleus, anterior choroidal branch, posterior cerebral artery, this part, the middle cerebral artery, internal carotid artery, anterior cerebral artery, this portion. And these giving branches and supplying with this, the chordate nucleus, the lentiform nucleus, and straight branches here. Recurrent branch of the anterior cerebral artery. Arteries supplying the brainstem and cerebellum. Arteries supplying the brainstem and cerebellum. Now the brain, these components are separate, are different. Their functions are different, but they are having the blood supply, and it is vascular, very vascular. Now, superior cerebral artery, pontine branch, labyrinthine branch, this is the basilar artery, posterior cerebral artery, anterior inferior cerebral artery, the posterior inferior cerebral artery, posterior spinal artery, this is the basilar artery, vertebral artery, anterior spinal artery. Now, blood supply of the spinal cord, anterior spinal arteries, and posterior spinal arteries. When the spinal cord, you see it, we have a spinal cord. We have a good brain. Only one specimen is there. Don't tamper. Don't টানাটানি করবে না, চুল টানাটানি করবে না. It will be damaged. Now, also, when you are studying the histology section, then you correlate with your histology atlas or any histology textbook. Veins of the brain, they are classified as veins of cerebral hemisphere, the cerebellar veins, veins of the brain stem. So I told you each component of the brain is having, they are classified as veins of the cerebral hemisphere, cerebellar veins, veins of the brain stem. Cerebellum, cerebellum, and veins of the brain stem. The cerebral veins are divisible into external group and internal group. See the picture. In brain, when you are studying the brain, you please draw pictures, copy from your book, outline them and slowly label, copy, paste. Just don't mug, copy, paste. Then it will be impressed in the brain and you can answer. And one thing, the scripts, last exam, say yes, you have to draw some figures. And also your books are having competency based. Now you go straight. I told you this is a game. You attempt for 60%. You draw, label them. Bhal lagje na, tired lagje. No, you just sit down and draw and label them today. Then keep it. Tomorrow, just recapitulate, study. Third day, you take your self-test. Or you sit together, your friends, and then group. The external group, internal group. These are sagittal section, this is the undersurface. Now, internal cerebral vein, basal vein and great cerebral vein. This is the Thalamus striate vein, choroidal vein, internal cerebral vein, basal vein, greater cerebral vein. Veins of the brain stem, midbrain drains into the cerebral vein, pons upper part into the basal vein, medulla oblongata into the transverse and occipital sinuses. So you draw the brain stem and you just label them. You have 3 highlighter pens, 3 colors. One color, one portion. And then midbrain drains into the cerebral vein, pons upper part into the basal vein, medulla oblongata into transverse and occipital sinus. Veins of the cerebellum, superior petrosal sinus and great cerebral vein, straight sigmoid occipital and inferior petrosal sinuses. Straight sigmoid occipital and inferior petrosal sinuses. Dural venous plexus. See, this is the internal jugular vein. Now, the anterior facial vein, pterygoid plexus, cavernous sinus, ophthalmic veins, frontal vein, emissary veins, superior sagittal sinus, internal sagittal sinus, great cerebral vein, rectus sinus, transverse sinus, superior petrosal sinus here, inferior petrosal sinus here, occipital vein, deep cervical vein. Now, what I want to say is that even venous sinuses of the brain can come at least 10 marks of 5 marks question. And when you are studying your sinuses, you please take the skull. There is a skull, sagittal section skull is there. Your transverse section of the skull is there. And also the cut portion you can put this. Then you open up. And you have to trace, you have to show which is the petrosal sinus, which is the sigmoid sinus in practicals. And also a question can come on long question. Now, pterygoid venous plexus. Yeah. This is the falx artery. Greater cerebral vein. Now, meninges of the brain. Now, the skull bone, dura mater, periosteal layer and meningeal layer, arachnoid villus, arachnoid matter, blood vessels here, pia matter, brain, grey matter, and white matter. When you see the cut surface of the brain in the dissection hall, you can clearly see the grey, you can distinguish between the grey and the white matter. Ventricles of the brain. Now, central part of the lateral ventricle. The anterior horn is the posterior horn, is cerebral aqueduct. The fourth ventricle, the median aperture here, central canal. Interventricular foramen, third ventricle, inferior horn, subdivision of the lateral ventricles are shaded pink. This is the lateral ventricles. Third ventricle of the brain, it has two lateral walls, anterior wall and posterior wall, floor, roof, cavity. Yeah. This is thalamus, the choroid plexus. In the third ventricle is the choroid plexus. Body of the fornix, corpus callosum, septum pellucidum, ependyma, chordate nucleus, stria terminalis, and thalamostriate vein here. Central part of the lateral ventricle, ependyma. Lateral walls of the third ventricle. The hypothalamic sulcus, intrathalamic cavernous, telicordia, epithalamus, suprapineal recess. This is the pineal body, the pineal recess, posterior commissure, aqueduct, tegmentum, posterior perforated substance, mammillary body, the hypophysis cerebri, tuberous cinereum, optic chiasma, optic recess, lamina terminalis, anterior commissure, interventricular foramen. The anterior wall of the third ventricle, fornix, anterior commissure and lamina terminalis. The pineal body is here. Now, anterior wall of the third ventricle, fornix, anterior commissure, lamina terminalis. Posterior wall, roof and floor of the third ventricle. This is the corpus callosum, septum pellucidum, interventricular foramen, the interthalamic connection, telecardia, epithalamus, suprarenal recess, pineal body. This is the aqueduct. This is the aqueduct. This is the hypophysis cerebri. This is the mammillary body. Now normal. This is the hydrocephalic. Brainstem. Brainstem composed of midbrain, pons, and medulla. Midbrain around the cerebral aqueduct, groups of cell bodies and tracts connect the cerebrum to the lower part and the spinal cord. Pons situated in front of the cerebellum, nerve fibers that connect the two hemispheres of the cerebellum as well as the brain and spinal cord. Nuclei act as relay station. Nuclei act as relay station. Now, brainstem, this is a picture you have to draw. The midbrain, pons, medulla oblongata. This is cerebellum. Brainstem, medulla oblongata, between the pons and the spinal cord, white matter outside, grey matter inside. Relay station for sensory nerves passing from the spinal cord to the cerebrum. Vital centers, cardiac, respiratory, vasomotor, reflex centers, decussation of motor and sensory tract. The brainstem, that's why any injury, you're hanging, then brainstem is first affected. The vital centers are here. Cardiac, respiratory, vasomotor, reflex centers, decussation of motor and sensory tract. Reticular formation, a collection of neurons in the brainstem, coordination of muscle activity and your selective awareness, autonomic nervous system. Now, reticular formation can be 4 marks short note. You can see it in the specimen. किताब में तो देखोगे. But please see the brain as a whole in sagittal section, in your transverse section, whatever we have, also the full brain with the brainstem, spinal cord, then it becomes easier. See, pulvinar part of the thalamus, pineal gland, medial geniculate body, lateral geniculate body, superior and inferior colliculi, cerebral peduncle, yeah, superior, middle and inferior cerebellar peduncle, yeah, and lateral exit foramen. Now, floor of the fourth ventricle, this is the floor of the fourth ventricle, superior, middle and inferior cerebellar peduncles, yeah. Telacordia, attachment for choroid plexus of both ventricles. And medulla itself. Now, obex, caudalmost point of the floor of the fourth ventricle. The median foramen is the roof of the ventricle of this level. Now, spinal cord, the elongated cylindrical part of the CNS, suspended in the vertebral canal surrounded by meninges and CSF, continuous as the medulla, continues as above as medulla. The spinal cord continues as the medulla and extends from the upper border of C1 vertebra up to the lower border of L1 vertebra. Lumbar puncture, procedure to get samples of CSF for testing, done at the level of L2, L3, L4, and rootlets emerge that combine to form roots of those in the nerve, spinal nerve on the side. Now, any patient with a high pyrexia, history of high pyrexia, also it can be like pyrexia of any origin, PUO. Now it can be typhoid, it can be general malaria, it can be due to meningitis, encephalitis, even a rare condition, amoeba in the brain. Only 300 cases have been reported in the world. One of my relative son, he is admitted for last 3 months in mission, and then he is in Park Circus Neurosciences. They diagnosed it, and he is still not released from the hospital. So don't take it, not everything. Clinical knowledge, you have to. The clinical knowledge, is it having any increase in the CSF or not? Then your study CSF, biochemical, physical, microscopical. But you have, at least I didn't have that knowledge about amoeba. And they are having your MRI, I think 4 MRI have been done. He was released. Again symptoms are rising. So you keep in your head, when you go to medicine, you please, because in the ward we used to do lumbar puncture. Nowadays spinal needles are there. Naturally, you don't write and call for the technician. You do it yourself. It is easy. In these levels, L1, L2, L3, L4, you put a spinal needle and then collect the CSF in the test tube. Now, spinal cord, end of the spinal cord, L1, L2, phylum terminal, spinal nerve. This is the dura mater. This is the lower end of the dura mater. Spinal cord internal structure, anterior median fissure, posterior median septum, central canal in the center, grey matter in the middle, white matter in the periphery. Please, Avinash, আমাদের তো spinal cord section আছে তো histology. You please look into it. It becomes easier for you to study the descriptive part of the spinal cord. When you are describing, then add a histology. This is spinal cord here, cervical, thoracic, lumbar. Spinal cord internal fractures. two anterior horns, two posterior horns, two lateral horns in thoracic, upper lumbar and sacral segment. Cell bodies of neurons are located sensory cells, lower motor neurons, connector neurons. Anterior grey horns transmit motor impulses sent from the cortex. Posterior receives the transmits sensory impulses to the cortex. Yeah. Dura matter, the spinal nerves, this is the arachnoid matter, this is pia matter, spinal cord. This, you take the specimen in the spinal cord in our lab. Lab means I am taking the section out. You study the composite. Composite means that has been torn. But brain in all sections and also the spinal cord as it is see the layers. एक बार देख लो and you also make notes and also see the histology slides. Now, spinal cord, internal structures, white matter arranged in columns or tracts, ascending and sensory tracts, lateral, anterior spinothalamic tract, anterior and posterior spinocerebellar tract, descending motor tracts, anterior and lateral corticospinal tract. Now, spinal cord cross section, see, this is the posterior column, the posterior median septum, the posterior grey column, the lateral grey white column, anterior grey column, anterior median fissure, anterior white column, and anterior motor nerve root, posterior sensory nerve root, spinal ganglion here. This is the posterior column, white column. Now, what I want to stress is that इसको अगर पढ़ोगे रटोगे आप drawing करो, label them, yellow for nerves, and you want to just simple drawing. At the most, you have these small pens are available now, not big markers. 4 or 5 colors are there. So you can, each column you can see and study also the posterior and anterior column. You make a key which color represent. Now, flexion rotation injury. The mechanism. One big, you see the pulleys. Suddenly if he falls like this, then it is expected that he will get a fracture like this. This is the injury. Flexion, rotational injury. Twist. The vertebral column and also the spinal cord. Crash injury from the ladder. Now, one thing I tell you, now people are staying in flats in big cities. Now, you gift your mom through Amazon a ladder, foldable ladder. Don't. You have a ladder in your home, but that foldable, that people are carrying in the motorbike for electrical connections and your cable connections and all. Don't gift that to your mom. Because these are the small things that is increasing road traffic, RTA, road traffic accidents are on the rise, and but modern living, Now, flexion injury mechanism falls like this, and this might be the condition of the vertebra and the spine and the spinal cord. Now, extension injury, see, is a head-on collision of the driver. This will be the condition of this. So, when you do an MRI or your X-ray, simple X-ray, you will get this the diagnosis. Extension injury, chance fracture. See, this is the fracture here. To cervical vertebra and the skull, I should told you, this is the odontoid process, the spinal cord, atlantoaxial axial injury, fracture, dislocation, and only dislocation. Tuberculosis of the spine, cold abscess. Tuberculosis of the spine, cold abscess. Paradiscal, central, anterior.